Hey everybody, my name is Sharon Quinn and I'm also known as the original runway diva, and you are watching Model Behavior. Class is officially in session. Today my guest lecturer is Karl Dixon, who is a practicing holistic dental hygienist and an outstanding jazz vocalist. Welcome, Karl Dixon to Model Behavior. You know, I was having a little trouble with it. I had to practice that hygienist word.
I'm so happy to be here.
I'm so glad that you are with me today, and I thank you for all of the compliments you gave me before we started rolling. But I'm gonna jump right into it. Okay. I'm come back to the music thing because you're an absolutely amazing jazz vocalist. But the thing that I didn't know about you that I want to focus on today is that you are a practicing holistic dental hygienist at Holistic Dentist of Tribeca since 1985. Now the thing I want to know is what on earth made you go into dental hygiene?
Actually, it was a girlfriend who dared me.
Really?
She said I couldn't do it. I was like, why not? Because no men had entered the field. I was the first male graduate from University of Medicine and Dentistry in 1983.
The very first?
The very first.
Okay. And what is it about, well, clearly you like it, or you wouldn't still be doing, or maybe you don't like it. Do you like it?
I like it.
What is it that you like about that?
I love my patients. And one of the things that really encouraged me to pursue it and continue in it is, as a child, I had some bad dentistry. I was a victim of some just not great dentists.
Okay.
And I was able to understand the internalized fears that gives you and how that affects how you take care of your mouth, just being scared to go to the dentist. And I wanted to change that attitude.
Oh my God, you hit that. You know how many relatives I got that won't go to the dentist because of the pain that's in the past that's been associated with that?
Absolutely. I'm so fortunate to have been in the same practice for 30 years. So a lot of my patients were children when I started seeing them, and now they're adults.
And
like, for example, they were 8 and now they're 38.
With a mouthful of beautiful teeth.
Or 12 and now they're 42, or 30 and now they're 60. So I've been able to grow with them and their families. I treat the children and the grandchildren. I've treated generations. So I've been able to see actually the fruit of my labor, or how I've changed the way people think about going to the dentist.
Well, now I know that as performers,
yes,
we know how important it is to take care of this.
Yes.
Why do you think that people have, skip that question that I didn't even get out. What is the number one piece of advice that you would give to people on the care of their teeth? It is the one thing that you should absolutely positively do besides brush them.
You should take into consideration, the mouth is the dirtiest orifice, so they tell us. Makes sense. It's also the way bacteria gets into our bodies. It's how we ingest bacteria. If this is the gateway to bacteria, dirtiest orifice, how can brushing your teeth alone solve the problem? That's the holistic approach. You need to wash your mouth. You need to brush all of the surfaces that bacteria can lay and grow. Most of what we teach, and I also teach at NYU. I've been there since 1994. I was the first male hygienist that they hired onto the faculty. We teach you how to attack the bacteria once it arrives.
Okay.
What if we created an environment that it can't live?
Well, how do we do that?
Completely different approach. It's a kind of a bit of incorporating some of the ancient techniques.
Okay.
One that's very popular now is oil pulling, and where you rinse with
the coconut oil.
I love the coconut oil, but the face that you're making was the face that I made when I had to rinse 20 minutes with it. It just did not. So I tweaked that. That was before the invention of a toothbrush.
Okay.
Now that we have a toothbrush, why can't we speed up that process?
Please tell me how to do that.
If you take the toothbrush and wash all of the surfaces, you're doing a number of things. One, you're stimulating your tissue to receive it.
Okay.
You're removing any surface bacteria that may be on your inside cheek, inside your lips, underneath your tongue, roof of your mouth. You also are preparing your mouth to receive the coconut. and you're giving yourself an examination. You are starting to feel about what's going on in your mouth. Some of the surfaces in our mouths we have never brushed. Certainly, if my hand was my dirtiest limb,
you'd be washing it all.
Washing my nails alone would make my hand clean.
Absolutely.
If I took some pipe cleaners and went in between and I rinsed it in some alcohol, certainly it would be cleaner than if I did nothing.
Mm-hmm.
But it would be cleanest if I just washed the whole beast.
So you're saying take the toothbrush
and wash
and
everything.
just go over
everything.
Inside the cheek, all
your
of that
mouth.
with the toothbrush.
With the toothpaste. First, because that's your detergent.
Right.
And do we ever moisturize our mouths?
No.
The acidity in the foods that we eat, certainly the acidity in the beverages that we drink, anything containing alcohol is drying out your enamel, drying out your restorations, and a drier surface is certainly more capable of breeding bacteria, and certainly a place where bacteria can stick.
You just made that so incredibly easy to understand. I ain't never been in a dentist's office and had them tell me this.
There, a lot of them aren't telling you that, because if you can control the number of bacterial organisms in your mouth, it's the bacteria that mixes with the sugar that produces the acids that cause decay. You can control that. It's the bacteria that gets up underneath your gums that causes periodontal disease. You can control that. If you're lubricating your restorations, they won't chip, they won't dry out, and your teeth can remain
in
shiny,
your mouth. And oh, Lord
shiny,
Jesus, okay.
Shiny. Oil dissipates stain. Why coconut oil? Because in some of the traditions, there were different oils used. There was sesame oil, and different cultures. What is really interesting, has been interesting in this search or this area for me, was looking at the different cultures and what they've used, and then how those things that was used before they had toothbrushes became obsolete once toothbrushes were introduced.
Oh.
The Latino community still uses white vinegar to gargle because it's antiviral and antibacterial. So gargling with it, you're killing bacteria in the back of your mouth. African cultures, coconut. We used to eat raw coconut, and because of that, our teeth are whiter, our enamel is stronger.
What? Okay.
The more Eastern Indian did the sesame oil with the oil pulling.
Let me stop you. One oil puller
I
thing.
lived in Saudi Arabia before you stopped me, where they used to do where I saw them with the bark cleaning their teeth. When I went to Saudi Arabia to live, to work for Aramco, I thought, oh my God, I was going to see the worst gums and think, no.
So that actually works for them.
It works because the bristles fan out and it's cleaning up underneath their gums. No gum disease. The teeth are staying because they're rubbing in the dates that they eat and some of the cultural foods that are staining. But it's not because the mouth is not clean. So we have some misconceptions about how we must follow Western traditions of brushing and techniques. And I know the modified baths and Stillman's clips are techniques that we teach in school, and they do work, and flossing every day. All of that works to remove the bacteria once it has arrived. But if we do that in conjunction with creating an environment that
where they can't thrive, then I got it.
We can control it. And I really want to get that message to our entertaining friends, because you're on the road sometime and you just ain't got it. You know that. Every country does not cater to people of color in terms of the items that you can purchase in the store. And we need certain things. We like certain things. And we need certain things. And ain't nothing worse than going up in the store where you on a tour going like, where's my stuff? Where's my stuff? My stuff ain't never coming. We can use these things to certainly keep us in a healthy state, because what you ingest comes out in your saliva, and we certainly know as entertainers, we can't afford nothing going in that's going to mess with them cords.
Nope. But
I know.
Before I forget,
could go on and on about this.
It's fascinating to me. You just made dentistry interesting, and that's hard to do. But you said you found a way to cut down on the amount of time with the oil puller. Once you take the brush and you
and you wash your mouth,
out.
Apply the coconut directly on the brush. and rub it in like lotion.
You stop.
Everywhere you washed. You can even leave the jar in the bathroom, take a teaspoon, put it on your brush. It's good to have on your brush because it's antiviral, antibacterial.
So it's killing what's on your brush. I did not know. Ooh, I got a big old thing of organic
and everybody
coconut oil
has it. Everybody
sitting
has
right up
it.
on my counter.
If your gums are inflamed, certainly you have to bring your mouth up to code. So, just like a house, you got to bring it up to code. If the window's out, you can't act like the window ain't out. The window's out. But once you bring your mouth up to code, you should be able to maintain it. If your gums get inflamed because some bacteria got up underneath some delicate spot or maybe around a crown or a bridge, you can add clove to the coconut and massage it with. Clove is what we used to use in dentistry for anesthesia. It's the active ingredient in Ambisol. You can use that to it's a stronger antibacterial. You can also add drops of oregano to the coconut and ingest it because it'll boost your immune system.
Okay, you see how I'm sitting here looking at you like,
and these are
I've never heard of any of this.
These are things that I didn't study. I found out because I've been a practicing holistic hygienist for 30 years. And my patients would come in to me and they would tell me these remedies and ask me my professional opinion, of course. What do I think, how would this work with their mouths and how would this work with their condition? And I would then say, let's try it. And we try it together. So I ain't talking about what somebody told me and I read, and this. I'm talking about what I've seen.
You've seen this because you've done it.
What we've been able to do together, me and along with my patients, under the auspices of my boss in the holistic field. It's my responsibility to understand the holistic concepts. So we have in the office that I work, we have a nutritionist who study Ayurvedic technique, where the oil pulling comes from. And we have a cranial specialist, and we have all these other entities. And through the course of my career, I've met herbologists and stuff to look and listen to what herbs are working and why is this working? Why is this coconut even working? Because it's such an amazing carrier oil and there's nothing in it.
Wow. Unless
you have allergies, and certainly search and see, have allergies to coconut, it just can do wonders in your mouth.
Wow, wow, wow. That is fascinating.
It's great when you go on stage. I use it to gargle with and put on the roof of my palate so I can hit my...
And it's not going to give you the... Don't make me don't have me making you sing, okay? Because I will ask you to give me 16 bars.
I'll give you a song.
Okay.
Right mad at you.
No, we're gonna go out with the song. But you got something really good going that I definitely want to cover before we run out of time. You started the Men of Dental Hygiene Social Club.
Yes.
And I want you to talk about that because it's amazing.
It was amazing for me too. What happened was one of my former students, who is now the director of sterilization at NYU, gave me this wonderful accolade as he was receiving an honor. And it just freaked me out. And so it made me think, well, what happened to the men that graduated? Let me just reach out to them. This academic year, the program that I teach at will be celebrating 25 years. So I went to the dean. I said, well, can I get a roster of all the men that have graduated during that time? And I got them together and spoke with them, and they have done some amazing things. I'm so proud of them. I'm so proud of them. One is the head of Hostos Dental Department. Another one started a foundation for Haiti. Some of them have gone on to be dentists. And we've mobilized ourselves to support men in the profession, because it's not a male-dominant profession. And also to reach out to the community as men and deal with the issues of health and wellness in our communities as men.
So this is men on men, men talking to other young men.
Young men, empowering young men, letting them see, because dental hygiene is a 2-year degree. I've gone on to study other things, but it's a 2-year degree, so it's accessible through community college. Great starting salary. There's so much need for young men of color, in particular, who are being so profiled now. And so disenfranchised because of that profiling. because the images that come out of America is how the world sees us.
Absolutely.
And so we're crucifying them before they even get out the gate. Feel that if I'm not going to be 50 cents or a doctor or a lawyer, I have nothing else to be but a drug addict.
And we are brilliant.
Or a drug dealer.
We come from, our bloodline, our DNA is brilliant.
Has to be, has to be, has to be, has to be. Who can go through that passage and come across there and still become president? In a land that does not.
Come on now.
A land that does not love them. I didn't say it didn't accept us, because we have excelled in every single thing we have achieved or attempted here.
Well, why is that not enough? Well, we're at the point now, 2015, we certainly cannot rest on our laurels, but not enough young people are researching our history. So they don't know.
They don't know
what a glorious history it is.
How strong we are, and that's part of me mobilizing the men of dental hygiene and even wanting to go into the schools and to let them see average men. I come from Farmville, North Carolina. I'm a preacher's kid. I'm one of 8. They weren't rich. You know that. Couldn't be rich with a bunch of kids. Okay, same mama, same daddy. You know, that whole thing that we want to let people. Society wants to give our young people the impression that that doesn't exist. You know, same mama, same daddy, married 54 years.
Come on now.
All 8 of us, same mama, same daddy. And it's not that there's anything wrong with my single parents, because one of my sisters is a single mom, divorced. And so it's not that there's anything wrong with being a single parent, but there's more of us than that.
And society would have you believe that we don't have
black men
two-parent
don't
household.
show up.
Yes. Yes.
And black men show up, even if I didn't marry mamas, they still show up. There's a lot of men that's showing up and paying child support and not having to be mandated to do that. And we're not celebrating amongst ourselves the beautiful things that black men are doing. The train driver that's keeping that job and paying that mortgage so his kids can go to school. We're not celebrating the cab driver.
Janitors, anybody that's got making an honest day's living.
And that have gone to school or excelled in their job. Even the manager at Burger King, he's a manager. He could have just been at the cash register all his life, but no, he still excelled. I think that it is time for us, our generation, to take a little bit more responsibility and letting the young men and the young people that are in school now, in junior high school, that may not be an A student. Everybody ain't an A student. Some of us are just seeing our way through. But there's still things for you to do. You can have a complete, rich, wholesome life.
I'll agree with that.
A provider for your children, a spouse, home, own a home, have a job that you're proud of, with a simple education or with your seeing your way through.
Come on.
And I celebrate them.
So this program that you're putting together, you're trying to go into the schools. You also said you're trying to go into prisons too?
I would love to go into the prisons, because a lot of them, especially when you're talking about the petty offenses that men of color are getting thrown in and locked in their right to vote, and their arrest record that can ruin their employment opportunities. They're 16, 18, 19, 21, 22. I can't imagine that.
Yeah.
I think they need to know that there's some hope. And I think education is certainly a way, but a practical education, an education with some skills that they can actually give back to that community. CPR is another one. I'm trying to get into the communities and teach CPR, so that we don't have to worry about 911 coming. We can save our own lives.
That's a good way of putting it. Swimming, all of that stuff, the things that...
Mama's having a heart attack in the projects. I don't have to wait 3 days for the emergency. We can start CPR and save mama's life.
How do you plan on instituting that? How do you plan on, have you already started that?
Completed the coursework. I can teach CPR. I'm working with a nurse, and we're going to go out.
So you're going to schools, or you just going to neighborhoods? How you plan on doing that?
Honestly, I would love to talk to the gang members.
Are you crazy?
I'm not crazy. Black folks need to save blacks. We need to make Black lives matter.
I get that.
And we need to save Black lives. If I see somebody going down, I can say, look, I'm certified in CPR, get out the way. Don't choke my brother to death.
See, that's a preacher's kid talking right there.
Know.
That's a preacher's kid.
That's a preacher's
I
kid.
don't fear nothing but that one.
No,
so
God
step aside.
sends me
Let
what
me go
you
ahead
gonna
and
do.
save this life.
If God send me, what you gonna do?
Okay, now we did you got anything else you want to tell me about the dental
I have
thing?
a blues CD that's coming out. I'm working on it.
Okay, y'all ain't heard. Wait.
It's called Ride. I redid Riding with the King, the Eric Clapton.
You haven't heard this brother sing. You have this. See, you did this.
And I'm working on some dance music that's going to be coming out, some house music. I love house music. There's some things on YouTube. You can Google me. Anytime.
And you just got back from Colombia?
Colombia. I was at Teatro Colón in Bogotá. And I was there with the Harlem Jubilee Singers. I've been with them for about 15 years now. And we were doing the music from Porgy and Bess. I was sporting life. It ain't necessarily so.
Now, Karl, you, clearly the music thing that's your passion? Because you seem to be really passionate about the whole holistic.
Well, it's amazing. It's been really interesting because all my roads are starting to lead to one. Mm-hmm. What I'm very passionate about is empowering people and showing people light.
Okay.
Seeing the light go off in someone's head.
And that brings you joy?
That brings me so much joy. If I'm singing and I see someone that really gets what I'm singing, that brings me joy. If I'm teaching and I have a student that really embraces the information that I'm trying to teach them, that truly gives me joy. I love when my patients follow my instructions and we see results.
Does that happen a lot?
Always. I've had patients for 20 years. One of my patients' wife was my patient in hygiene school. And he's been with me since I've been working.
Okay, so y'all must be doing some really good stuff over there at Holistic Dental of Tribeca.
I don't know if they doing good stuff. I'm doing good stuff.
I'm sorry. My bad. Because I'm not gonna lie. I'm looking for another dentist.
Most people are. I want to, because that's why, if you notice, I'm not really trying to advocate my practice so much, because what I really want to advocate is that patients become aware, understand their mouths, because all of the dentistry that you're receiving is not the best quality
I know
dentistry.
that.
And it's usually because we don't understand it. I didn't mean to tell you, I'm going to start a webinar and a seminar to teach people, the layperson, how to articulate their needs. What tends to happen often is we sit in the chair because we don't want to feel pain, mentally, physically, or financially, and we pray and hope that it can go fast.
I don't really care if it doesn't go fast. I just need to know every time that I come in there, it says everything $100?
Is everything going on?
Yeah, what are you fixing now?
Well, most people want a pretty smile, a pretty healthy, happy smile. And I believe in that. I don't think you have to have perfect teeth. I think you have to have pretty, healthy, happy teeth, clean teeth.
Yeah, I want them to be clean. I just don't want them to fall out.
Exactly, healthy. That's the healthy part. And if that's your major goal, then if you understand it in the context of your mouth, then you can say, I don't need that, or show me why. But a lot of us don't understand how to see a radiograph and know when there is decay, how to really see bone levels. And with my patients, and my patients will tell you, I draw pictures for them and I go over the radiographs with them because I want you to know your mouth so that nobody can tell you what's going on in your mouth. And that's the whole holistic approach too, because once we bring it to code and you control the bacteria, I can't tell you got 5 cavities. Because you look at me and go like, no, I don't, there's no way.
And I'm glad you brought that up. How do you, because I feel, this is a new dentist, it's been like 2 years now. I feel like they be making stuff up. I'm not even.
Well, it's not so much that they make.
I feel like,
well, see, it's not so much that they make stuff up. We need to own some of this.
Okay.
If you sat in the chair and told me, I don't want to feel it, I don't want to hurt me mentally, financially, or physically, do what you got to do. That's giving me a blank check.
But see, I don't say that.
A lot of people do. And then if you don't know if you're not asking for explanations of what is actually happening in my mouth, any doctor, it's that whole creed, the oath, the doctor, is that I'm supposed to try everything I know to make you well. From the Rolls Royce to down to the Toyota. I'm supposed to go through everything and check every possibility of anything that could be wrong in order to try and complete resolution for your mouth. I'm supposed to go to the nth degree in trying to find out what your problem is if you don't tell me what it is.
Well, how do you sit? Okay. All
So
right.
when you do that, not tell me what it is, that means I'm going to explore and I'm going to find, well, maybe this is it, so I'll fix that. Well, maybe that is it, so I'll fix that. But you say, no, no, no. I know what my problem is. I know my mouth. There may be some incipient decay, some early things, but there's things you can do holistically to start to work on that. Certainly the coconut oil helps in working on that because you're lubricating the grooves of your teeth with an antibacterial, antiviral.
Okay.
Bacteria can't live. You can have
I'm about to have the cleanest mouth in New York City. Y'all don't even know.
And it will actually be. Your pH levels in your mouth will lower and all of that. If you are cut out on, you can give yourself a litmus test and see the acidity of your saliva yourself. So then you know, okay, my saliva is getting kind of acidic. I got to like cut this down. I got to drink some more water. I rinse with some more water. You can start to be a little bit more aware of your mouth. I know I have a weak spot back here. I know I have because you're feeling everything when you wash your entire mouth every day and take the day off. Something's going on here before it gets to be a big problem. What tends to happen is it's just like, unfortunately, an unfortunate reference, cancer. You can't wait till you get to stage 4 to start talking about now I'm gonna start eating right.
Absolutely.
Now you're going to need surgery.
You gotta do some
and you're going to do
preventative
something
stuff.
else.
Yeah, you gotta be
so
proactive.
before you get to the point where it gets blowed up, we can talk that.
Finish your thought.
Before it gets to the point where it blows up, you want to address it.
Okay.
And you want to control the bacteria in your mouth. You want to be able to look and understand a radiograph so you know how to bring your mouth up to code.
Okay, now I'm gonna stop.
Model
We
behavior.
are
That's a model
almost
behavior.
out of time. I'd like to thank my guest, Brother Karl Dixon, for sharing his industry knowledge with us today. And I know I learned a lot about my mouth, and I'm gonna practice that when I get home. Before I go, I'd like to leave you with a few thoughts. Remember that you can't change the game until you first learn the game. Always surround yourself with positive people and positive things, and do what you love and love what you do. And lastly, be who you are, but be who you are tastefully. Always have a little class about yourself. Don't forget to like us on Facebook, follow us on Instagram, Twitter, and Pinterest. Did you miss an episode of Model Behavior? Now you can view the previous episodes on our YouTube channel. Just Google Model Behavior with Sharon Quinn, and all of our previous episodes will come up. Thanks for watching Model Behavior, and I'll see you next week. Class is officially dismissed. Bye, y'all. You are so...